Hello everyone, I'm Dr. Roshan Dixit. I'm the Senior Consultant Haematology and Bone Marrow Transplant in Aakash Super Speciality Hospital, New Delhi. So today's topic of discussion is what to expect before, during and after a bone marrow transplant. Bone marrow transplant एक procedure है which is usually recommended during the period of treatment of cancers like leukemia or lymphoma in certain conditions. It can also be recommended in certain benign disorders, yani non-cancerous situations like aplastic anemia, thalassemia, sickle cell anemia and other bone marrow failure syndromes. So जब भी कोई बोन मैरो ट्रांसप्लांट एडवाइस करता है पेशेंट के लिए, द फर्स्ट स्टेप इज़ यूजुअली HLA मैचिंग. दैट इज़ वी ट्राई टू आइडेंटिफाई विच इज़ अ suitable donor for a patient. Usually the donor is a family member, and if we don't find an HLA match donor in the family, we sometimes search for HLA matches in stem cell registries, which are like blood banks in a way. And if we don't find a fully matched donor either in the family or in the stem cell registries, we usually go for half match transplant sometimes. So after we identify a donor, then comes that the patient is prepared for the transplant, and we look for patient's disease status, that is assessment by bone marrow studies or PET scans. We also evaluate the fitness of the patient to undergo a bone marrow transplant. So the patient undergoes a battery of tests which is aimed to look at his cardiovascular system, his respiratory system, his other vital organs like kidneys and liver, to see if there is side effects of the transplant which we can predict from before. After we find a suitable donor and the patient is cleared in all other aspects for a transplant, the patient undergoes a procedure which is called conditioning. That is done when the patient is admitted. So now we come to the phase what to expect during the transplant. So the patient is usually admitted for around 3 to 4 weeks during a transplant. At that point, the patient undergoes conditioning therapy. That is, the patient is prepared to receive the graft, and that includes a combination of either chemotherapy only or combination of chemotherapy and radiotherapy, and sometimes we may add some immunotherapy to the mix. After the conditioning regimen, the patient's bone marrow is usually ablated, that the diseased marrow is removed, and the patient gets the graft from the healthy donor. After that, the patient goes through a period of obligatory cytopenias. That means the patient's hemoglobin, WBC and platelets remain at rock bottom levels. उसी टाइम पे पेशेंट को हम सपोर्ट करते हैं through transfusions, through antibiotics, platelet transfusions, blood transfusions, nutrition and supportive management, and that takes around 2 to 3 weeks. After the patient blood parameters become normal, the patient starts eating well, the patient is usually discharged on immunosuppressive medications, and the patient goes to the next stage of transplant, that is the post-transplant care. So in the post-transplant care, the patient usually stays nearby the hospital with frequent clinic checkups and admissions to the daycare for supportive treatment. The supportive treatment may range from nutritional support to managing side effects like graft versus host disease, or sometimes infections, bleeding, and any other side effects that may come during the transplant. So the entire period of transplant ranges for around 5 to 6 weeks from the time we start initiating the process of transplant to the completion of the transplant. And the post-transplant period usually ranges from 1 month to 3 months, in which the patient is constantly monitored very closely. And the long-term side effects of transplants are usually managed over a period of years, for which the patient needs to visit the doctor intermittently. So if you have any questions regarding bone marrow transplant or whether it is suitable for your cancer, please do not hesitate to contact us and find us in Aakash Hospitals, Delhi. Thank you very much.